Today's video would be studying the clavicle, and here we have the outline of all we'll be discussing: the peculiarities of the clavicle, its features, muscle attachments, ossification, and clinical correlate. Now, the clavicle is a long bone and it forms part of the bones of the upper limb. In the human body, there are 64 bones in the upper limb with 32 on each side of the body. The clavicle is a bilateral structure, meaning that we have one clavicle on each side of the body. Okay, now as I stated earlier, it's a long bone, meaning that it has a shaft and two ends. Also, it's the only long bone in the body that lies horizontally. All other long bones in the body lie vertically. Okay, another peculiarity of the clavicle is the fact that, unlike other long bones, it exhibits intramembranous ossification. Now, generally, there are two types of ossification: intermembranous ossification and endochondral ossification. Most long bones exhibit endochondral ossification, and most flat bones exhibit intramembranous ossification. However, the clavicle exhibits intramembranous ossification, unlike most long bones. Okay, also it has two primary ossification centers, which is unlike most long bones of the body. It doesn't have a medullary cavity. Okay, so generally in a bone we would have the cortex and then a medullary cavity. However, the clavicle doesn't have a medullary cavity, and it's the first bone to start ossifying in the human body. It's also subcutaneous and it can be palpated. Palpable or palpated is a fancy word meaning that it can be medically examined by touch. Okay, so it can be felt because it is subcutaneous. In this picture here, we can see the clavicle, and this is just to show that the clavicle can be felt and it's a palpable bone. It's subcutaneous, meaning it just lies below the skin. It's also important for us to take note of the fact that the clavicle forms part of the pectoral girdle. Now, the pectoral girdle is made up of two bones, is made of the clavicle and the scapula. Pectoral is a word used when referring to the chest or the breast area, and a girdle is a structure that surrounds something. Okay, so the pectoral girdle is made up of the structure that surrounds the chest area, so to say, and it's made of the scapula and the clavicle. Now let's take a look at some of the features of the clavicle. Taking a look at the superior surface of the clavicle that we have here, we can see that the superior surface of the clavicle is smooth, and this is because there are no ligament attachments to the superior surface. However, taking a look at the inferior surface of the clavicle, we can see that the inferior surface is bumpy and there are some depressions and so on, and this is because of the several ligament attachments as well as muscle attachments. So, having stated that the clavicle is a long bone, meaning that it has a shaft as well as two ends. The two ends of the clavicle are the sternal end and the acromial end. Now, the sternal end of the clavicle attaches to the manubrium of the sternum, while the acromial end of the clavicle attaches to the acromion of the scapula. Now, the sternal end, as we can see here, is bulky. Okay, the sternal end is bulky and it attaches to the manubrium of the sternum. However, the acromial end is flattened from top to bottom. Okay, and the sternal end can be said to be quadrangular. Here in this picture, we can see that we have the manubrium of the sternum. The manubrium of the sternum is the topmost part of the sternum. The sternum is made of the manubrium, the body of the sternum, as well as the xiphoid process. Taking a look at the superior surface of the clavicle, we can see that it has an outward curvature towards the medial side, and it has an inward curvature on the lateral side. Now we can say that the clavicle is convex on its medial two-third and concave on its lateral one-third. Okay, now anteriorly, which is towards the front of the body, anteriorly the clavicle is convex. Okay, anteriorly the clavicle is convex at its medial two-third. However, looking at the posterior surface, we can see that on the posterior surface it is concave. So we have to be specific in anatomy. So we would say that the clavicle is convex on the anterior medial two-third, okay, and it is concave on the anterior lateral one-third. Okay, now let's take a look at some of the other features of the clavicle that we have here. Right here on the medial side of the clavicle, on the inferior surface, the inferior medial part of the clavicle, we can see that we have a depression here. Now this depression is for the costoclavicular ligament. Okay, the depression that we have here. This depression is for the costoclavicular ligament. Also, we have a groove here, and this groove is for the attachment of the subclavius muscle. Also have the trapezoid line, which is for the attachment of the trapezoid muscle. We can also see here that we have the acromial facet, which attaches to the acromion of the scapula, as well as the sternal facet, which attaches to the manubrium of the sternum, forming the sternoclavicular joint. Next would be considering the muscle attachment to the clavicle. And here we can see that we have attached to the clavicle the sternocleidomastoid muscle. Okay, it's attached on the superior surface of the clavicle. We can also see that we have the attachment for the pectoralis major muscle, and the surfaces indicated in red are muscle origins. The surfaces highlighted in blue are muscle insertions. We can see that we have the trapezius muscle having an insertion at the clavicle. We also have the deltoid muscle having its origin at the clavicle, and we can see the spots highlighted in green are for ligament attachments. Now let's take a look at some of the ligament as well as the muscle attachments of the clavicle. Considering the ligament attachments, we can see that we have the sternoclavicular ligament. The sternoclavicular ligament, we have both the anterior sternoclavicular ligament as indicated here, as well as the posterior sternoclavicular ligament. We also have the costoclavicular ligament that attaches to the first costal cartilage of the first rib, that attaches to the costal cartilage of the first rib, and it attaches through the inferior medial surface of the clavicle. That is where we have the depression or the indentation for the costoclavicular ligament, as we saw earlier. Here we can also see the interclavicular ligament, which joins both the left and the right clavicle together. Okay, so the ligament runs from one clavicle to another, as we have here. Now here we have the subclavius muscle. We have the subclavius muscle here attaching to the the groove for the subclavius muscle. Okay, so on the inferior surface of the clavicle, we have the groove for the subclavius muscle, and we can see here in this picture how the subclavius muscle attaches to the inferior surface of the clavicle. This is also a view of the costoclavicular ligament that we have here, as well as the sternoclavicular ligament here and the interclavicular ligament between the two clavicles. The lateral side, we have the conoid ligament that attaches to the conoid tubercle on the clavicle and the coracoid process of the scapula. Okay, we also have the trapezoid ligament that attaches to the trapezoid line of the clavicle and the coracoid process of the scapula. These two ligaments are collectively known as the coracoclavicular ligaments. Taking a look at the muscle attachment of the clavicle, we can see here that we have the sternocleidomastoid muscle attached to the clavicle. We also have the pectoralis major muscle having an attachment at the clavicle. We have the deltoid muscle here having an attachment to the clavicle, as well as the trapezius muscle on the posterior side having an attachment to the clavicle. Okay, here in this picture we can see the sternocleidomastoid muscle. The sternocleidomastoid muscle is named by its attachments, by its different attachments. So steno has to do with the sternum, cloido has to do with the clavicle, and mastoid has to do with the mastoid process of the temporal bone. Here in this picture we can see the mastoid process, which is a process of the temporal bone of the skull, and the sternocleidomastoid muscle has an attachment to the mastoid process. It has an attachment to the sternum as well as to the clavicle, which we are considering in this video. Okay, so this is the sternocleidomastoid muscle. The next muscle we would be considering is the pectoralis major. The pectoralis major has the clavicular head as well as the sternocostal head that we have here. Okay, and we can see that there is a muscle, there's an attachment of the pectoralis major to the clavicle. It's one of the muscle attachments of the clavicle. It also attaches to the sternum at the sternocostal head, as well as the lateral lip of the intertubercular groove or sulcus. Next muscle attachment we'd be considering is the sternocleidomastoid muscle. The sternocleidomastoid muscle is attached to the sternum as well as the clavicle and the hyoid bone. Now the hyoid bone is of importance, is a solitary bone in the neck region of the human body, and this bone can be used in postmortem diagnosis of strangulation. Of course, we have the deltoid muscle, which has its name from delta, the Greek alphabet delta, because it has this deltoid shape, so to say. So it's the deltoid muscle, and it also has an attachment to the clavicle, as we can see here, as well as the trapezius muscle which is one of the muscles of the back. It also has an attachment to the clavicle. Taking a look at the ossification of the clavicle, as stated earlier, the clavicle exhibits intramembranous ossification, and it has two primary ossification centers and one secondary ossification center at the sternal end. Okay, so the secondary ossification center is at the sternal end. Now the two primary ossification centers that we have here appear between the 5th to 6th week of fetal life. okay, and they fuse at about the 45th day of fetal or intrauterine life, which is just a fancy word for in the womb, or life in the womb. So while the embryo is still developing, this ossification center appears at about the 5th to 6th week of the fetal life. The secondary ossification center appears at about 15 to 17 years of age, and it fuses at about 21 to 22 years of age, where it fuses with the shaft of the clavicle. Let's take a look at some of the clinical correlates of the clavicle. Here we saw that the clavicle has an outward curvature on its medial 2/3 and an inward curvature on its lateral 1/3. Now the point between the medial 2/3 and lateral 1/3 is a likely point of fracture for the clavicle, okay, and this occurs mostly when an individual falls on an outstretched arm. Okay, so the force is transferred from the arm to the clavicle and it could lead to fracture. In this image, we can see that we have here the fracture to the clavicle just at the junction between the lateral 1/3 and the medial 2/3. Okay, and we can also see here in this picture how it appears on the surface of the body. Okay, so this is a fracture to the clavicle. And the clavicle could also be congenitally absent, which means that a child could be born without the clavicle, total absence of the clavicle, or partial absence. In this radiograph, we can see that the clavicle is absent in this individual, and it's a condition called cloidocranial dystosis. Cloido is used when referring to the clavicle, and of course cranial to the skull. Dystosis is an abnormal bone formation. So the cloidocranial dystosis is a congenital anomaly where the bones of the clavicle as well as the cranium have an abnormal formation, and in this case we can see that it results in a total absence of the clavicle, and it could also sometimes be a partial absence where a part of the clavicle shaft is present, however the remainder of the shaft is absent. Here in this picture we can see how the cloidocranial dystosis appears on the surface of the human body. Going by our outline, we have come to the end of this video. If you liked this video, please give it a thumbs up and don't forget to subscribe. Thank you for watching till the end. Bye.